suffering with hypothyroidism? Around 1 billion people across the world are suffering with thyroid disorders. 90% of those are suffering from hypothyroidism, also known as underfunctioning thyroid. If you're one among them and looking for natural remedies to deal with thyroid disorders, then this video is for you. In this video, I want to share the causes and symptoms of hypothyroidism and natural remedies and supplements that you can take at home that will help you deal with thyroid disorders. Please note, however, if you've been taking medication for long periods of time, always discuss any changes to your diet or adding natural supplements with your medical practitioners before you do that. If you're new here, I'm Saroja. I'm a holistic health coach, a qualified homeopath, and a nutritionist. For the best natural healthcare advice and tips, subscribe to my channel and hit the bell icon so you get notified every time I post a new video on a Friday. Let's get started. Thyroid gland plays a vital role in producing hormones that are used by every part of our body. Hence, it's very key for our entire health. People suffering with hypothyroidism or underfunctioning thyroid generally suffer with poor metabolism. This could lead to weight fluctuations like weight gain or unable to put on weight. Hypothyroidism is a medical condition that occurs when your thyroid gland is not producing enough hormones that are important to your health. This is also called as underactive thyroid. What are the causes of hypothyroidism? Some of the factors that can influence thyroid gland function are medication. Some medication like lithium that is used in treating mental and emotional problems like manic behavior, bipolar disorders, and anxiety can contribute to hypothyroidism. It affects the thyroid gland and increases the risk of hypothyroidism. Thyroid surgery. Cutting a portion of your thyroid gland or removing the whole gland can reduce or stop the production of vital hormones. The patient will have to use thyroid hormone for life in such cases. Autoimmune disease. Hashimoto's thyroiditis, an autoimmune disease, is one of the most common causes of hypothyroidism. This happens when the body makes antibodies to attack or damage thyroid gland and its capacity to synthesize hormones. Radiation therapy. Radiation employed in treating cancers of neck and head can upset your thyroid gland and trigger hypothyroidism. Over-response to hyperthyroidism drugs. People who are treated for hyperthyroidism, which is the production of excess thyroid hormones, with an anti-thyroid medication or radioactive iodine, can sometimes overreact to this. This can end up lowering the production of thyroid hormone below normal levels and lead to hypothyroidism. Deficiency of iodine. Although a trace metal, this nutrient is essential for production of thyroid hormones. When the body is deficient in iodine, it leads to hypothyroidism, and when it is excess, it worsens the hypothyroidism. Congenital disease. Some infants are given birth with either no thyroid gland or a defective one. This can be inherited or caused by other factors. This also causes hypothyroidism in the child. Pregnancy. Some women can develop hypothyroidism during or after pregnancy. This happens because their bodies produce antibodies that attacks their own thyroid glands. This has to be treated immediately, as this could lead to complications. Pituitary disorder. Hypothyroidism can happen when the pituitary gland is unable to produce enough thyroid-stimulating hormone. This arises when there is a non-threatening tumor in pituitary gland. Disorder of hypothalamus. When hypothalamus in the brain doesn't produce enough TRH hormone, this leads to an exceptional form of hypothyroidism. TRH hormone controls the release of TSH from your pituitary gland. Thyroiditis. This is an inflammation of thyroid gland. This leads to leakage of thyroid hormones into the bloodstream, thereby increasing the levels of thyroid hormones and leading to hyperthyroidism. However, after a month or two, it develops into hypothyroidism. This can be caused by pregnancy, autoimmune condition, bacterial or viral infection. Comment below and let me know if you're suffering with hypothyroidism and how you're coping with it. What are the signs or symptoms that you might notice if you have hypothyroidism? Neck enlargement or discomfort. The symptoms include developing a hoarse voice, discomfort when wearing high neckline clothing, an odd feeling that something is swelling in your neck or a visible lump on the neck, joint and muscle pains, tendonitis, and carpal tunnel. If you have carpal tunnel syndrome or you are experiencing chronic aches, pains, and weakness in joints, arms, and muscles, go to your doctor. These are all potential signs of an undiagnosed thyroid problem. Changes to hair and skin. Hair loss or bad skin that could be fragile, hypersensitive may also indicate thyroid problems. Irregular menstruation. Painful or very frequent periods, infrequent or light and short menstrual periods can all be associated with thyroid problems. Bowel issues. Long-term or severe constipation, IBS or irritable bowel syndrome, and diarrhea may also indicate thyroid disease. Cholesterol. High cholesterol that seems to be difficult to treat or lower, as well as unusually low cholesterol levels, can also indicate thyroid issues. Check out my website to find out more about how you can deal with long-term health conditions using homeopathy and nutrition. Anxiety and depression. Many patients experience panic disorders, anxiety attacks, and depression together with their thyroid condition. Fatigue. Some patients feel exhausted even if they get enough sleep and rest. This may also lead to insomnia. Weight loss or weight gain. Being unable to gain or lose weight, even if you're following a strict diet and exercise program, may be a sign of thyroid problem. Unexplained weight loss when you're not exercising or following a strict diet plan is also a symptom. What are the natural remedies that you can use to deal with hypothyroidism? Iodine. Many sufferers of hypothyroidism also suffer from iodine deficiency. The thyroid gland requires proper levels of iodine to function properly, which is why keeping iodine levels balanced is important to control hypothyroidism. Chlorophyll. Chlorophyll supplements help build healthy red blood cells, provide essential copper, and help oxygenate the body, while also helping improve the skin health. Chlorophyll and copper supplements are also available as oral supplements or as topical lotions. Balancing estrogen levels. Excess estrogen levels in women slows down function of thyroid gland. In addition to avoiding estrogen-rich food, you can also try reducing or removing birth control medication from your daily regime. Zinc and selenium. In addition to iodine deficiency, zinc and selenium deficiencies are the most common in those who suffer from hypothyroidism. These types of deficiencies can also cause decreased thyroid activity and in turn decrease thyroid hormone levels. It is important to note that zinc must be never taken on empty stomach. Using coconut oil. Organic cold-pressed coconut oil is good for speeding up metabolism and encouraging thyroid hormone production. A teaspoon of coconut oil daily can improve thyroid conditions. Taking L-tyrosine. Many naturopaths recommend 500 mg of L-tyrosine taken up to 2 or 3 times a day to help increase the production of thyroid hormone. This natural amino acid aids the body to produce much needed hormone while also helping get rid of depression that often accompanies the condition. L-arginine. This thyroid stimulating amino acid not only improves thyroid function but also improves the hormonal health. Here are some of the natural supplements that you can take to help deal with hypothyroidism. Always speak to your doctor about taking natural supplements, as some of them could interfere with your existing medication, and it's always safe to check the side effects before you start taking them. Vitamin B complex. In addition to improving the function of nervous system, vitamin B complex helps in stabilizing mood swings, building energy, as well as healing wounds. Vitamin C. Eating vitamin C rich foods such as citrus fruits can help increase your vitamin C levels. Supplements also help promote the natural function of thyroid gland and in turn increase the production of thyroid hormone. Multivitamins or multiminerals. Multivitamin and multimineral supplements that contain vitamin C, A, B complex, B2, B3, B6, E, selenium and zinc are very helpful in promoting and supporting normal thyroid function. Iodine, tyrosine also boost thyroid production along with some very good herbal supplements. So there you have it, my natural remedies and supplements that can help you deal with hypothyroidism. I hope you can benefit from some of the nutritional advice and tips I shared in this video. If so, give it a thumbs up. Share it with your friends and family who are suffering from hypothyroidism and looking for natural remedies to deal with it. Subscribe to my channel so you get notified every time I post a new video on a Friday. If you have any topic suggestions for my next video, comment below and let me know. Thanks for watching. Until next time, stay healthy.